We are working to transform community mental health services in the Black Country that support adults with severe mental illness. This video shows a service user's journey before our services have been transformed. Meet Nadia. Nadia lives in Dudley. She contacted a GP needing support. Nadia was booked in for an assessment. During the phone call, she was told she would need a few different treatment options to meet her needs. This made her worry about being bounced around different services. After the phone call, Nadia felt lost. She really needed someone to speak to. She felt like a burden after being told she would need a few different treatment options. 2 months later, Nadia had her phone assessment. She was advised that she would need to be referred into secondary care, but there was a really long waiting list. Nadia was left feeling lost. She wished there were more options. She really needed to speak to someone and didn't know how long she would have to wait. A year later, Nadia was still stuck on the waiting list and hadn't heard anything from the trust. She was really struggling and was desperate for some support. She ended up in crisis and was admitted to hospital for 3 weeks. This meant that she was away from the things that kept her well, such as her family and friends and her job. After she was discharged, Nadia had 2 weeks of home treatment. She was still sat on the waiting list and still hadn't heard from the trust. 2 years later, and Nadia is still waiting for support. Nadia worries about ending up in crisis again and having to be admitted back into hospital. Here's how Nadia's journey will change after the community mental health transformation. After the transformation, Nadia has access to more options to get support. She can call our 24/7 helpline, contact her GP or a mental health professional at her local GP practice. After the transformation, she can get support within 4 weeks of her assessment, and that support will be tailored to suit her individual needs. Nadia is given a named mental health worker to help her access the right services and support. This takes away baffling admin and improves Nadia's experience when trying to access support. After her assessment, Nadia is added to a waiting list. To help her manage her mental health needs while she waits, she's signposted to online self-help support along with some services provided by local voluntary organisations. This helps her feel valued and supported, and Nadia feels confident that she will be able to avoid a hospital admission. Before the community mental health transformation, Nadia would have only been able to access support provided in her local area. This would have been a real barrier. After the transformation, she will be able to access holistic, personalised care provided in all our Black Country communities. Care and support such as clinical interventions, financial wellbeing, housing support, lifestyle support and social inclusion is wrapped around Nadia, making services more accessible and giving her the option to choose the right care to suit her needs. Nadia receives personalised care and support from professionals who have a range of skills and experience. These people may belong to different organisations, but they will work as one team to support her. This enabled Nadia to access care and support that's tailored to her specific needs while being close to home. After Nadia finishes her treatment and is discharged, she can re-enter our services easily by contacting her named mental health worker. This will mean that she won't have to retell her story or wait for an assessment. Find out more about how we're transforming community mental health services by visiting www.blackcountryhealthcare.nhs.uk and search for Community Mental Health Transformation.